Good morning, everybody. My name's Oscar from Physio Physique, and today we're going to be going through a simple ankle taping just to demonstrate. So, a bit of context to this. Ankle sprains, and particularly lateral ankle sprains, are the most common sporting injury. Particularly, there's a ligament on the outside of our ankle that is commonly injured, and so taping can help to prevent a re-injury of this. The taping we're going to be showing you today is very simple. It's commonly used with lots of sporting clubs, and the way we think about this is there's a 3-2-1 method to it. So you think of it what we call 3 stirrups, 2 figure sixes, and then 1 heel lock. So again, before we're taping, we want to make sure safety wise we've got no cuts or abrasions on the skin. We don't want to be taping over the top of that. And also, if the athlete or patient themselves can shave the area just above the ankle, just so that we're not taping on hair. That's preferable just for the athlete or the person themselves, so they're not ripping the tape off of the hair later on. Okay, so we'll have a look at just here. In this position when we're starting, ideally we want to have the foot in a neutral position, what we call plantar grade. So we'd start like so, and we'd ask the patient or the athlete just to bring their foot over the edge, like this. Okay, so I've got the standard, what we call 38mm rigid tape here. So to start with, you're just going to need 1 strip, and above the ankle joint you want to go about 2 fingers, just above there. What we're going to do is we're going to place a piece just around. That's just called an anchor strip, just so we've got a piece to stick onto. Always trying to make sure that the tape itself is nice and clean. Alright, as we talked about, we want to be doing 3 of what we call stirrups. So they're going to come around. You can measure the tape like so. And with these we want to be going medially to laterally, so starting in the middle, coming over the ankle bone itself there with a medial malleolus, and then running around to the other side and providing a bit of tension as you do that. It's important as well as you're doing this, you want to stay clear of the base of your pinky toe, what we call the base of the 5th metatarsal there. So I'm just going to repeat that again. You can go over that same strip a couple of times, but you can also go half and half. So you might go half behind that strip that you've done first, and then half the other way. Okay, so that's our 3 stirrups done there. The next what we're going to do is we're going to do heel locks. So we do 1 of these each way. Sorry, not heel locks. We're going to be doing figure sixes. Apologies. So starting again immediately, coming around. This time though, I'm going to hold the tape and then come across the foot. Again, still try to maintain that neatness with your taping. It's going to be much more comfortable for the athlete or the patient themselves. Again, providing a bit of force down through here, and then coming across. Alright, so we've got our 2 figure sixes there. And then to finish with, we're going to do a heel lock. So for the heel lock here, start, we're almost going straight across, coming around the back of the heel, and this is just really locking that off through there. Alright, so that's all nice and firm, and then just to finish off, again as we've done at the start, we just provide that anchor just on top of the tape to make sure everything's all okay. When you're going around on those Anchor strips, again, when you're going around a limb, you want to make sure that it's not too tight, because obviously then we can restrict blood flow. At the end here, we just want to check. So give the toes a squeeze, check there's some good capillary refill. Ask the athlete or the patient themselves if it's too tight, and then you want to get them to do a bit of a test on their ankle themselves and just check that that's comfortable. All right. Thanks for watching.